Hi, JJ and Mrs. Jones. JJ, it's really great that your mother could be here today for this educational session and that we could arrange this. I'm Lisa and I'm your nurse today. I know you're an adult and at the age of 20, but it's always nice to have an extra set of ears along so that if you have any questions or forget something that had been mentioned or taught, that person can help you remember those things. I know that you're here in the hospital because you had a sickle cell crisis as a result of your sickle cell disease. And now that your pain is under control and you're feeling better, I think this is probably a good time to teach you about ways in which you can prevent another sickle cell crisis. Can you tell me about your experience and do you know what caused it? Okay, yeah, that's right. Unlike normal red blood cells that are smooth, round, and flexible, your red blood cells are sickle shaped, which is caused by the abnormal hemoglobin S, and this is a hereditary condition. So basically, these flawed red blood cells block the flow of blood to the smaller blood vessels because of their shape, but also because they stick to each other and to the endothelium which is the internal lining of the blood vessel. So here is a picture. This is kind of depicting what is going on inside of you. As you can see, the round blood cells are normal red blood cells, and the sickle cells are the ones that you have because you have sickle cell disease. And you can see here that they are clumping together in the blood vessel, okay? And that's because, again, they stick to each other as well as to the endothelium, which is actually the internal lining of the blood vessel. So this causes a blockage of the blood vessel. It doesn't allow that blood to move through the vessel to feed the tissue and the organ or whatever's over on this side, the nutrients and oxygen that it needs. So basically, you had mentioned that the blood vessels, that you had dactylitis, which is the swelling of the joints in the hands and the feet, and also splenic sequestration or pooling of the trapped blood in the spleen as a result of the occluded or blocked blood vessels. So unfortunately, because of that, there's no way for the blood to move in and out of the spleen, and it causes that pooling of blood in the spleen, and it causes an enlargement. You also mentioned that were extremely weak with your sickle cell crisis, and that you were short of breath, which are other indicators that your body's not getting all the oxygen that it needs. All organs and tissues have the potential to get injured by the occlusive nature of sickling red blood cells, which is the blocking of blood vessels by the sickled red blood cells. So here I have another picture. This is actually the complications of sickle cell disease or even sickle cell crisis, which is what we're talking about today. So the acute complications would be related to sickle cell crisis, and then there's also chronic condition complications that can occur when sickling continues to occur and sickle cell crises continue to occur. It causes damages to these organs. So we're going to talk about some of the most common ones today, which usually sickle cell crises mostly impact the bones, the brain, the penis, the eyes, the liver, the heart, and the lungs. And when the sickle cell crisis impacts the lungs, it's called acute chest syndrome. And like we have been talking about, basically what's happening here is that the tiny vessels that feed the lungs are becoming occluded or blocked by these sickled cells. And basically an acute chest syndrome is when it's basically the symptoms are fever, pain, violent coughing, and these symptoms are similar to pneumonia. So if these tissues are deprived of oxygen from sickled cells for a long period of time, it can lead to permanent damage of nerves and the organs, especially in the kidneys, liver, brain, and spleen. And then patients that have multiple sickle cell crises causing splenic sequestration like you've had may need to get their spleen removed. Typically this happens in adults just from repeated pain crises and The unfortunate part is that because the spleen is injured or damaged and needs removed, it actually makes the individual with sickle cell disease more susceptible to infections, because the spleen actually acts as a filter. It's part of the immune system, and it helps to rid the blood of bacteria and the things that can cause infection. The spleen especially helps fight certain kinds of bacteria that cause pneumonia and meningitis. So, unfortunately, this is one of the complications of your disease. So, another complication, a more prevalent one is, and most feared, is the complication of a stroke. The vaso-occlusive nature, or again, blockage, vaso-occlusive means the blockage of the blood vessels, by the sickling red blood cells, can also impair the delivery of oxygen to the skin tissue. Especially in the lower extremities, in your legs. Many times patients with sickle cell disease develop these leg sores. Fortunately, you don't have any of these, but it's worth mentioning. Again, it's caused by the fact that the blood is unable to feed oxygen and nutrients to the skin tissue, and this causes these wounds to develop. And unfortunately, a lot of times these wounds take a long time to heal for the same reason, because the oxygen and nutrients that help in the healing process are not available to the skin tissue. So now that you know what the complications can be, you can understand why it's so important to take the necessary steps to avoid a sickle cell crisis. And there are things that you can do. Do you have any questions about the problems that can arise in a sickle cell crisis? Can you tell me some of the major complications of sickle cell disease? That's correct. So the acute chest syndrome, splenic sequestration, I cannot say that word, and stroke. However, all organs can be negatively impacted by the disease as a result of oxygen deprivation, which is another important consideration. So now we're going to move on to preventative measures, because there are things that you can do to prevent sickle cell crisis. And because of the damage sickle cell disease can cause, we want to be sure that you're educated about how to try and prevent the complications of pain crises in the future. This can be achieved by maintaining good nutrition, taking medication according to how it's prescribed, and also some other measures that we're going to go over. Unfortunately, there's also some unknown causes. And even if you're doing everything right, there might be, something that triggers an episode of a sickle cell crisis. But we're going to just focus on what you can prevent in trying to minimize these pain crises that you've been having. So, do you know what caused your pain crisis? Okay. Yeah, I had read that in your record. I had seen that you had been out in the cold temperatures. So yes, extreme temperatures, especially cold temperatures, can cause flare-ups. Swimming in cold water, high altitudes, any type of stress, heavy physical labor can also trigger a flare-up. I noticed also that you play softball, so it's really important that in that case you're not overexerting yourself and you're taking a lot of breaks when you're playing. And it's also very important that you stay hydrated. Dehydration is one of the triggers for a sickle cell crisis. So you want to make sure you're drinking plenty of water. The reason dehydration can cause a sickle cell crisis is because the blood becomes concentrated and it increases the sickling of the red blood cells. One of the biggest reasons for sickle cell crisis, however, is infections. So if there's some important things that you can do to prevent infections. One of those is making sure that you get your routine vaccinations. So you want to get your yearly flu vaccine. You want to make sure that you're vaccinated for pneumonia. You want to wash your hands frequently. You want to make sure you're staying away from people that are sick. So I know you live with your mom and I think your siblings. So it's important that if any of them are ill, that you try and isolate yourself away from them until they get better, so that you don't get sick. And another thing is just to make sure that you have your regular dental exams. That way, if you have an abscess or something that you don't realize you have, that can be taken care of immediately and no infection can result. So the other thing to do is if you do feel like you're getting sick, or if you're spiking a temperature, it's important to go to your doctor immediately. Some infections are viral, others are bacterial. If it's a bacterial infection, you can get medication like an antibiotic to help fight off that infection. And that's important too, because to limit the time that you have the infection too can actually help you decrease the risk of having a sickle cell crisis. It's also important that you avoid decongestant medications. Decongestants can cause constriction of the blood vessels. So constriction means narrowing of the blood vessels. So back to our picture here, you can see that obviously if the blood vessel becomes narrower, it's going to be harder for those sickle cells to pass through. So it's important to avoid decongestants. And finally, smoking cigarettes. Well, it's just bad all the way around. But the reason why it's bad in patients with sickle cell disease is that it can actually impair the flow of oxygen to the lungs, and it can trigger an acute chest syndrome, which is one of the sickle cell crises events that can occur. So it also impairs the amount of oxygen that the rest of the body gets, because it's impairing the oxygen amount the lungs get. It's impairing the amount of oxygen the entire body receives, and it can lead to lung infections also. So that's another thing that is very important. Smoking is very important for you to avoid. Nutrition, moving on to nutrition. A high-calorie, nutrient-dense diet is very important for patients with sickle cell disease, such as fruits, vegetables, whole grains, and legumes. As mentioned earlier, it's so important to drink plenty of water to prevent dehydration. The recommended amount is 8 glasses per day. I know you're 21, and I know you'll be probably consuming a little alcohol soon, but you do want to understand that an alcoholic beverage is not a substitute for water. So, in fact, it actually dehydrates. It causes one to urinate more. So it's important that you minimize your alcohol consumption and continue to drink your 8 glasses of water per day. Patients with sickle cell disease just expend more energy in general as opposed to patients that don't have the disease. And this is because of their anemia. Your red blood cells break down faster than a patient, I don't want to say normal, but a patient who doesn't have sickle cell disease. Therefore, it causes you to always be anemic or always have low blood counts, and decreases the amount of oxygen to the organs and the tissues. Therefore, individuals with sickle cell disease need to have about 1 to 3 times the recommended intake for most of the essential nutrients. Some of these can be consumed as supplements. So we encourage that you take your supplements of vitamin A, B6, C, E, the carotenoids, magnesium, and zinc supplements. And I'm not expecting you to memorize these. I will be giving you some handouts here too to help you when you're discharged, so that you can refer to them and remember what supplements are important to take. And studies have actually also shown that by taking these supplements, you reduce the incidence of acute chest syndrome from sickle cell crises. In addition, omega-3 fatty acids also help to increase the fluidity in the membranes of the red blood cells and help decrease the incidence of sickle cell disease. So that's another important one to take. Sorry. And the reason, also another really important supplement to take is folic acid. That's probably one of the most important. You want to take 1 milligram daily. It's needed because it's used in the production of red blood cells, and because of the sickling and the unsickling of the red blood cells in patients like you with sickle cell disease, this causes the cell to break down faster than a normal red blood cell. Therefore, the lifespan of a sickle cell is shortened by about 90 to 100 days. So as a result, folic acid is definitely on high demand and needed for red blood cell production. And finally, medications. They also play a very important role in minimizing the chance of a sickle cell crisis. It's important for you to take your medications according to how your physician prescribes them. I saw in your health record that you are taking hydroxyurea, and this is given to patients with sickle cell disease, as you know, to increase the water content in red blood cells, causing which causes a decrease in cell deformity. And also it reduces the adhesion of red blood cells to the endothelium, which again, we had described as that internal lining of the blood vessel. It also increases the nitric oxide level, which helps dilate or relax the muscles of the muscles of the blood vessels, causing them to widen and improve blood flow. So again, back to our picture. Instead of like decongestants, they constrict, they narrow it. Nitric oxide actually makes them wider, makes it easier for the sickled cells to get through, so which is important and helps, and is the reason why that medication works so well. So when taken daily, hydroxyurea reduces the frequency of sickle cell crises, and it also decreases the need for blood transfusions, which is one of the treatments for when you're in a sickle cell crisis, which I know you're familiar with because you had one while you were here. So the downside, unfortunately, every medication has a side effect, and hydroxyurea is an immunosuppressant. So it increases the risk for infection. So again, if you can recall, what are some of the ways that we discussed earlier to prevent infection? Right, exactly. So routine vaccinations, hand washing, you want to avoid other sick people, and you want to make sure you get those regular dental checkups. So, and hydroxyurea is another reason to adhere to, obviously, these safety measures. We want to make sure, because it's an immunosuppressant, that you want to make sure that you're decreasing your chance of getting an infection. And then also, patients taking hydroxyurea should not receive live vaccines. Live vaccines work by stimulating the antibody production in your body, but because the hydroxyurea is an immunosuppressant, it actually depresses that response. So, in fact, when you get a live vaccine, there would be more of a chance of you actually getting the illness that the vaccine is trying to prevent you from getting. So it is important that you do not get live vaccines. So can you tell me the main ways in which the hydroxyurea prevents sickle cell crisis? Right, that is correct. So it increases the water content in red blood cells. It reduces red blood cells adhesion to the endothelium or internal lining of the blood vessels. And it increases the nitric oxide, which dilates the blood vessel. So very good. And then I also saw that you had recently been taking penicillin, which is an antibiotic, for a tonsillitis infection. And as mentioned earlier, it's important to take your medications as prescribed. I had seen that you apparently were taking too much, and it actually ended up causing a complication for you in the past. So it's really important that you take, especially antibiotics, according to how your physician prescribes them. These are important because, again, they're helping you fight the infection and helping you limit the risk of developing a sickle cell crisis. And so you want to make sure that not only do you take them according to how they're prescribed, but that you take them for the duration that they're prescribed. A lot of times patients will start feeling better and think their infection has resolved and, stop taking these antibiotics just to find out that no, in fact, their infection is still present, and it prolongs the infection process. So it's very important that you take those drugs, antibiotics, according to how they're prescribed. So that's pretty much it. I mean, I'm going to make sure that prior to you being discharged that you get all the handouts and all of the information that we discussed today. I think it's very important that you have them to refer back to in case you have any questions in the future. Also, the handouts will have several ways in which you can contact some local sickle cell disease organizations that can help assist you with any questions about your illness. And then also, it's important that while you're here, if you have any questions that you can your nurse or the physician that's rounding on you before you go. Do you or your mother have any questions for me today? Okay, well, it was a pleasure getting to meet you and talking to you today about how to prevent sickle cell crises. And I wish you both the best. Take care. Thank you.